and the mud will accumulate at the apical 1/3, and then your master bone doesn't reach. That is the problem. This is when the canal is straight. When it is curved, then it is even more difficult, because you are directly rushing to the apex. In crown down, you first take care of only coronal 1/3. Because remember one thing, law of physics. In endodontics or in root canals, the resistance is always coronal. The resistance is never apical. If you see an X-ray, you will see canal in apical 1/3. You normally see canal in apical 1/3. But still your file doesn't go in. Why? So interference is not there. Interference is at coronal 1/3. So you open up coronal 1/3. That is called as coronal flare or free flaring of an orifice. Now once that interference is removed, will you be able to advance easily? Yes. Then you reach middle 1/3. Now most of the curvatures will start after middle 1/3. So once you have opened this, there is a good chance that your first 10 number file will take that curvature. And it will not get blocked anywhere. And you will not form any ledge. Once you are through with the middle 1/3 enlargement, then you take care of the apical. So this is a concept called as crown down. In this, the advantage is you are not pushing any debris into apical 1/3 because you are taking it out. In step back, you are straight away going down and then trying to clean that, where the taper is only 2%. So it is difficult to clean a pipe, and it is easy to clean a glass because of shape. So what our job is as an endodontist, you clean this bottle like this. You can't do this with the tooth. So you try to do that in the tooth. Create a shape so that it cleans. Ultimate objective of root canal treatment is what? Shape to clean, not cleaning and shaping. You never do first cleaning and then shaping. You will shape to clean. You provide a shape, it automatically cleans. So the greater taper technique. Crown down is a concept. Now in that crown down concept, there are various file systems available. You have pro tapers, you have wave one, you have all Niti rotary file systems will be crown down concept, but they are not true crown down concept because pro taper is a variable taper. So it's a selective engagement. Now what we are going to talk about is K3XF, which is by SybronEndo, and it is a pure crown down system. So you start with the bigger instrument, and as you go deeper, you shift the size of the instrument to a smaller size. That is crown down. Simple. So what are the advantages of K3XF? These are Niti files. Everybody will be working on them today. This is a G pack of K3XF. Now it has 6 files. Can you just distribute the pics? The G pack which is available, which is there in the kits, starts from, this is a 25, the tip diameter of these files is 25 and has a it starts taper from 10, 8, 6, 4. You can see that here. First is 25, 12. What does it mean? 25 tip diameter and taper is 12. So if the tip diameter is 25, you add 12 to it. 1 millimeter से वो इतना फाइल बढ़ेगा. So it is naturally meant for coronal method because it is a greater taper file. And we are moving.
Can you just please repeat it?
The first file in the kit is 2512. So 25 is tip diameter and 12 is a taper.
Right.
Now everybody is through with the taper, what taper is. Second file is 2510. So 25 tip diameter and taper is 10. Then it is 25.8. Then it is 25.06. And then it is 25.04. So you are, what is happening? The taper is reducing. So you are going crown down. So 12 will remove the coronal 1/3. 10 will remove till middle 1/3. 8 and 6 can go to the apex. If they don't go, you take 25.04 first and then finish it with 25.06. So in the literature, there is enough evidence that canals are thought to be clean if you have a taper of 6 or greater than 6. So taper 4 will be used where? Only in lower anteriors, where you have thin roots. In premolars, maxillary premolars. Rest all the canals can be finished up to 25.08 or 25.06. Okay. So let's understand the K3XF system. It has got positive rake angle. Now what is the difference between positive and negative rake angle? Carpenter देखा है ना? What do they do? Have you seen? Randa बोलते हैं उसको रंदा. That is positive rake angle. So it is cutting in positive plane. The file is cutting in, so there is less engagement and it is easier cutting. As compared to that, if you consider negative rake angle, this is like you apply butter to your bread. This is negative rake angle. While applying butter to your bread, do you cut bread? But if you try to apply butter on bread like this, you will cut. No difference. So positive rake angle is advantageous. Then it has variable pitch. Variable pitch is distance between two threads of the file, flutes. If it is equal, you have a pulling sensation of the file. The file will be pulled in the canal. And then there is a chance of engagement and fracture. So here you have a variable pitch where the debris will not be pushed out, pushed in, it will be taken out. So that is the importance of variable pitch. Then the most important aspect of these K3XF files are they are R-phase heat treated. So they are not grounded as like the Pro Tapers and other file systems. They are the NITI while manufacturing, the NITI is grounded. So if you look at under semi-electron microscope, you will see some micro cracks in the file before it reaches to you. So that increases the or reduces the fracture resistance. So these are R-phase technology where there are no micro cracks on the file. And they are extremely flexible also. It has a non-active tip. There is a radial land. Now what is radial land? वो शेविंग का ब्लेड देखा है, उसको sharp edge होता है. Everybody has seen a blade which has a sharp edge. If you blunt that edge, that is radial land. So the file becomes less aggressive in the canal. So all those who have used other file systems will find that these files are slightly slow in cutting. But it is always better, rather than doing any accident in the canal, it is better to be safer. So maybe you will have to use these files at a higher RPM, that is 500 RPM. Rest all other files are advised to use at 300 RPM. Because they are radial landed files, they take more time to cut. But it is a safety mechanism. Okay. Then You have apex locator. Which apex locator you use? J monitor. Root ZX. C root. You find any problem using C root?
Sometimes it's not a
Sometimes.
I combine with X-ray and.
Okay, how do you use apex locator? All those who don't have apex locator, how do you use it? Now this is an apex locator by Sybron, apex ID, very reliable multiple frequency apex locator. When do you use apex locator? At what step? Immediately after opening the root canal, put a file and take a line?
No.
Then when?
After canal.
Always use apex locator after coronal 1/3 enlargement, because then your file will bind only at the apex. It will not bind into the coronal 1/3 and you will not get false reading. What file to use for apex locator? You want to use 10 number, you want to use 15 number, you want to use 20 number.
10.
Do you always use 10?
Yeah.
What if the canal is wide? In canine,
No.
in palatal, maxillary molars, you may have to use a bigger file. Select a file which has an apical resistance to your tooth. If 10 number is too loose, use 15 number. 15 is loose, use 20 number. But very rarely you will have to go beyond 20 or even 20. So the apex locator is to be used only after coronal flare, usually with 10 number or 15. When you use apex locator, there is a lip hook here. This goes in the patient's lip, in the mouth like this. This has to be moist. And then this is an instrument. Always put a file in the tooth first and then attach this clip. And once you do that, move the file up and down. I will show you how to do it. Move the file up and down. Once you move the file up and down, the graph here should also move up and down accordingly. When you put the file and suddenly the graph goes down, that means it is not a reliable reading. So you have to reproduce that reading 3 to 4 times, then you can consider it as a reliable reading. Of course, you have an estimated working length before you start because you have an X-ray. So you know estimated it is 17 or 18. So if it is showing 0 only at 13, then that means something is wrong. Okay? So whether you buy, whatever you buy, you should be having an apex locator if you want to do good endodontic procedure. So apex locator is indispensable in modern endodontics because you cannot have an accuracy if you don't have apex locator. Okay. So once you are through with the middle 1/3, you have your working length ready with you. By that time you have used 2510, 25.8 and then it's time to use 2506. Now after 2508 you will take apex locator reading. For example, your working length is 17 mm. Your 2506 should go to your working length, that is 17 mm, because you know now what is your working length. If 2506 doesn't go, what to do? Goes, come back, take 2504 first, and then 2506. Once that is done, there is something called as apical gauging. Are you aware of apical gauging? Once you finish with 2506, take your 25 number K file, red file, and put it in the canal. Now you know your working length. So if it binds at that working length, and and there is resistance to pull, that means your preparation is done because the apical size is close to 25.